Hey everyone, my name is Jason. I'm the founder of HealthOpsy.com. I'm a certified health coach and I'm passionate about health and wellness. Today I'd like to talk about something that is really prevalent in our society, and that's the coronavirus, or COVID-19. Some of you may have already hunkered down in your house, been mandated by your governor to stay at home. Some of these are effective ways of mitigating the transfer of this virus. Social distancing, proper hygiene, making sure that if you have any symptoms, you isolate and quarantine. These are effective methods of keeping the virus contained and not giving it to one of your family members or loved ones. However, in the medical community, there are some treatments that are being proposed as effective. A few of them I want to go over right now, just to keep you aware of some of the dangers that some of the drugs actually have. I myself am not a medical doctor. I have had a side effect from a medication which I feel has altered my life in many ways, so I'm an advocate for others to do their research on any medication proposed by their health practitioner or doctor so that they're aware of the side effects. So some of the COVID-19 coronavirus medications I want to talk to you about today do have some of these side effects or similarities about a drug that I have taken, which is a fluoroquinolone. So one of the proposed treatments for COVID-19 right now is a antiviral medication called chloroquine or hydroxychloroquine, and that's part of the quinoline family. These drugs do have detrimental side effects to them. I feel they're poorly understood and they really shouldn't be given to anyone, but unfortunately the FDA says otherwise. You know, I'm an advocate for self-knowledge and looking into drugs that you're going to take, looking for the side effects and really getting down to the science of, is this drug going to help you or make you worse off? And I know Donald Trump, our president, has touted the benefits of this drug, which I feel was a little too soon to say because there's really no trials based on evidence right now that are proving it to be a safe and effective method to treat the COVID-19 virus. Now, if you're in the situation where you have a severe case of this disease, this virus, I suggest you work with the best of the best medical practitioners out there, or at least get some information from these medical practitioners on the safety and efficacy of any treatment that they give you. So I just want to implore you to do your own research, ask questions if you may need these medications, because any drug in the quinoline class I feel is very dangerous, and I think you should research them on your own. There is another form of treatment they're proposing as effective, and that's Remdesivir. It is also an antiviral medication. It was used in Ebola in the past. It actually failed as a drug treatment for that, but Remdesivir, it looks like it could be an effective treatment for the COVID-19 virus. There's also convalescent plasma transfers, which they're taking blood from people that are asymptomatic, have essentially beat the virus in their system, and they're taking their plasma and giving it to people that their immune system has not yet regulated or adapted to the virus load on their body. So that is a promising way to mitigate some of the effects of the virus in the body. Me and my family, or myself and my family, have really thought the ways that we're going to combat this by social distancing ourselves from one another. But if we had to go to an emergency room or a doctor's facility, we were going to preemptively say that we didn't want the hydroxychloroquine and look for alternative medicines if we do get sick. And I really suggest you revise these treatment strategies with your family, friends, and loved ones in case this does happen to you, and hopefully it doesn't. So if you're looking to boost your immune system to combat any type of viral load in the body, you're really going to want to take all the fat-soluble vitamins, also the water-soluble vitamins and trace minerals, giving your body all the tools it really needs to combat any virus or infection. Keeping your immune system in line will really help you mitigate any severity from a virus. Also, there are some other things you can take, like peptides. There's a peptide called thymosin alpha 1 that regulates the immune system and the T cells. It basically revamps your body's immune ability and innate response to any viral load by regulating the T cells in the body. You could take the immune system of a 50-year-old and reverse it to adolescent years because it regulates the immune system so well that this peptide can really help. I suggest a protocol for a few weeks on this peptide to get your immune system adjusted and regulating the way it should be, and being enhanced by this peptide. It will move very fast and you'll feel the effects within days. Also, you can take a lot of adaptogenic herbs and a lot of prophylactic herbs, like golden seal for respiratory infections, or echinacea, or elderberry. All of these herbs, minerals, vitamins, and peptides can enhance your immune system to combat this virus in case you get it. All of these herbs, medications, minerals, and vitamins, and peptides can really help your body combat this virus. Once again, my name is Jason from healthopsy.com, and I wish you and your family a healthy and happy week.